A lot of children are malnourished in Nigeria. So many kids suffer from malnutrition. Malnutrition is when a child lack the proper nutrients, vitamins, mineral necessary for their development and growth. Hi everyone, this is Clara, your public health specialist. Malnutrition is a major public health concern in Nigeria, especially among under 5 children. According to WHO, 2.5 million children suffer from severe acute malnutrition in Nigeria. This is a very serious case, and we don't see it. As someone that works in the communities, in the villages, in suburban area, I have had first-hand experience of this. You see these kids, they are underfed, they look unhealthy, they look tattered. In fact, these kids look so hungry. And you see that this malnutrition is very, very serious. Malnutrition have serious, long-lasting effects on children's health. In fact, it can cause them to be physically undeveloped. It can even impede their mental development. It can lead to stunted growth. It can also weaken their immune system. That's how bad malnutrition is. And children under 5, their immunity is not so high like an adolescent or like an adult. These kids need proper care always. And this malnutrition is something that you see everywhere. Even if you are staying in the urban region, your child can be in your house and be malnourished. If your child is not getting that proper nutrient, that proper vitamin in any food that you are serving to that child is malnourished. You might think that you're feeding your child well, but you're not giving that child the necessary nutrients and vitamins that that child needs. Your child is malnourished. Now, malnutrition is caused by a whole lot of things. It's caused by poverty, which is the very major one, because most of these families are poor. They can't afford to buy the necessary food that are contain these nutrients that the children needs to eat. And lack of clean water too. Poor sanitation, lack of education. A lot of them don't know what this malnutrition means, and they don't even know that their child is malnourished. Because if you don't know what is happening to a child, how do you take care of that child? And some of them they live in an unhygienic environment. Their environments are very dirty. They don't practice proper sanitation. So these kids are being subjected to this daily, in and out. Now, this is something that I am calling all health professionals to be on deck. It's not something that we leave for anyone. The government needs to come into this matter very well. They need to ensure that these families, these communities, this village have access to clean water. They have access to proper healthcare services. They have access to proper education. And they should also ensure that the economy is made favorable for the low class. Because if the economy is very high, if the economic situation of the country is not favorable, these families cannot afford to buy good foods for their children. The government is at the forefront to fight and abate this malnutrition in Nigeria as a whole. Now, we as health workers, we need to ensure that we teach these people, give them proper health education, teach them what malnutrition is, tell them what they need to feed their kids, teach the mothers, the women the nutrients that their child needs at each age. I'm talking of on the 5 children. Let them know what they need to feed these kids. Let them know how to um, keep their environment clean, maintain proper hygiene. Let them know how to, you know, get accessible water. Even if the water in their community is not so clean, teach them on how to, filter water and also make it clean. Teach them on how to, you know, take these kids to the hospital or to any healthcare center close to them. Let them avoid all these norms, cultural practices that impede children's health and cause kids to not grow well. Let them take what is available in their environment and feed those children. It's the food must not be so delicious and sumptuous. There are so many local delicacies that can be fed to these kids that can improve their health, boost their immunity, and also make these children to be healthy and not be malnourished. You see some kids, they're looking pale. You see some kids, they don't have energy. These kids don't have energy. Small thing like this, they are sick. That's because the child does not have any immunity. The child does not have the nutrient they need as a child to grow. You see a child of that has that needs to develop well. That child is not the cognitive ability is not there. The child is not interacting well because this child is malnourished. This child is not eating well. You see, this child is always sick. That's the cause of malnutrition. We need to speak to mothers and teach them what this malnutrition is all about. And also, we also need to involve the stakeholders, the policymakers of the communities. Teach them what it means for these children to manage because our children are the future. Also, we should make policies that benefit these kids. Make policies that ensure that these children are being noticed. These children are being incorporated into the affairs of the society and Nigeria as a whole. Ensure that these children are being taken care of. There should be policies made available or implemented for these kids, for these mothers, especially the mothers, because they are the ones that will take care of these children. So all has to be on deck, from the mothers to the community to the fathers and down to the government. We need to cooperate together to ensure that malnutrition is eradicated in Nigeria.